Okay, we are recording. Kathy, would you like to welcome everyone?
Well, now I get to do my official duty. I would like to welcome everyone on behalf of NAMI Yavapai and the Arizona Parent Family Coalition, and especially the Northern Arizona Parent Family Coalition. So let's go. I'm looking forward to this.
Okay, and I want to share that this is uh, through a grant that we have with Arizona Complete Health. So first, I'd like to welcome Heidi, Heidi Axon. Did I pronounce your name correctly?
It's technically Xene.
Axine, thank you. Well, I'm glad I asked. So before moving to Arizona, Heidi worked with the state of Missouri to deinstitutionalize individuals with disabilities, helping them transition into independent living with the necessary supports. She led a successful vocational rehabilitation program that not only provided job skills training, but also partnered with businesses to highlight the benefits of hiring individuals with autism and to develop workplace accommodations for their success. For the past 11 years at Polera Health, Dr. Axine has developed and implemented an autism program serving children and adults across Yavapai County. Her team offers individualized and group skills training, respite care, and education for caregivers. With specialized background in special education and focused on autism, she remains dedicated to enhancing opportunities and support for individuals on the spectrum. So needed. Thank you. Next, I'd like to introduce Lindsay Zeter. Now, Lindsay, did I pronounce your name right?
You did, yes, perfect.
Okay. Lindsay joined the Mercy Care family in January 2015 in the Children's System of Care, where she managed the direct care services for Medicaid recipients and integration of behavioral health and physical health services with the Division of Developmental Disabilities. At present, she is the Children's System of Care manager, managing statewide initiatives and improving healthcare outcomes for children with disabilities in the state of Arizona. Before her role at Mercy Care, she worked in an outpatient behavioral health provider, assisting members with community stabilization and coordinating intensive services, including levels of care with Division of Child Safety, DDD, and juvenile probation. She has 16 years of experience working in the behavioral health provider community and the families with special healthcare needs. So thank you, Lindsay, for being here. Next, I'd like to introduce Nia Uhlenhake. And I'm thinking I pronounced that right.
I am beyond impressed, actually.
Okay, all right. So Nia is a dedicated mother of two boys, one of whom is now 17 and was diagnosed with autism, ADHD, ODD, and anxiety at age 6. This pivotal moment sparked a profound journey of learning and advocacy, leading her to apply for a position at the Division of Developmental Disabilities, which eventually led her to Arizona Autism United. There, she was given the opportunity to establish and grow the Family Support Program. She is now the Family Support and Community Outreach Manager with a team of 5 additional family support specialists. Outside of work, she enjoys many hobbies, including dancing, piano, and photography. But her most favorite thing to do is cheer on her boys when they play baseball, soccer, and basketball. Thank you, Nia, for being here. Christina Hedges, next. Christina serves as the Office of Individual and Family Affairs Administrator for the Division of Developmental Disabilities. She's been with the division since 2016 as both a support coordinator and behavioral health advocate supervisor. She has over a decade of experience working with children, youth, and families throughout the state. As a native Tucsonian, she is passionate about serving her community, ensuring Arizonans have access and resources needed to thrive. Christina is a proud mother of 3 children who have behavioral health needs, including 1 child on the autism spectrum. In advocating for her children, Christina has navigated the various systems, including the behavioral health system and the DDD system. Thank you for being here. Ashley Johns, next. And as I understand, a new board member of NAMI Yavapai. Thank you. Ashley is a doctoral student at NAU, Northern Arizona University, in the Combined Counseling School Psychology PhD program in Flagstaff. She's a scholar of NAU's Culturally Centered Addictions Research Training graduate certificate program within the College of Health Equity Research. Her research and clinical interests include autism, post-traumatic stress, resilience, alcohol and/or drug use recovery, and culturally sustaining and responsive practices. She is a graduate assistant for the Autism Support, Community, and Education in the Navajo Nation through the Dene Parents Taking Action program at NAU. Thank you for doing all those things. And boy, such a need. And glad to see the inclusion of the reservation.
Happy to be.
Last but not least, Katie Martinez. Katie is a credentialed family support partner of Arizona Autism United, passionate about empowering families in Northern Arizona. She works to connect families with essential resources, ensuring they receive the support they need to thrive. Katie, would you like to add anything to that?
Sure. So I am a native Northern Arizonan, and I am very passionate about helping families in Northern Arizona. And I am because my son was diagnosed with autism, and I went through the experience of not having resources for him, and really going through the nitty-gritty of like finding them myself. So I love helping my families in all of Arizona, but especially Northern Arizona.
All right, thank you. Anybody else like to add to what your bios were indicating? Okay, then we will move right into the presentation. We have a couple of questions to focus on, and we are not limited to these. So I thought I would just read the first question. What have been the positive highlights of your experience as a family member or provider regarding services and outcomes? We'll get to the other side of that, but I thought let's start on an upbeat note. And I'll let the panelists just unmute and start sharing. Who'd like to start?
I'll start. I think for me, a positive highlight has been to find a support network with other parents, especially in rural communities. I think that's something that we rely a lot on is, word of mouth. And actually the parents community is strong with and supporting each other and getting each other connected. So that's been a positive highlight of my journey as a parent of a kiddo with a disability, is how great the parent network is.
Okay.
I can jump in as well. I think for me as a professional, one of the highlights is providing just a rural community with resources specific to autism, bringing families together, and just really providing the community with just education and, like I said, resources around supporting somebody with autism and finding services. I love being like the resource, guru.
When you say resource, can you be more specific? What does a resource?
Well, resources would be parent support, finding different like respite providers, educating families on, DDD, what supports they can and cannot provide. We've been running a parent support group or caretaker support group for a couple years where they can come together and just kind of have a platform where they can talk about successes, challenges. We bring special speakers in to discuss like specialties around certain topics, holding a pretty successful resource fair once a year where we have a lot of the ladies sitting here attend as well. I really like giving families some I'm trying to find a specific word, but just, an avenue to help relieve some of the stress that these families have when they're raising somebody with autism or any disability.
Thank you. Who else would like to share about positives?
This is Christina. I can share. Oh, Deb J entered the waiting room. Let me
Got
let
it.
her in, and then I can share.
I got it.
Oh, perfect. So I think one of the positives for me and my family, is kind of actually surrounding ABA, which I know is kind of a very contentious and controversial topic, and service for many different reasons. However, we, kind of went through the standard process of my son was diagnosed at 3. We were recommended to get 40 hours of ABA because it's the gold standard in treatment for autism. And we, didn't really know any different. So we went forward with it. And as I think we got lucky because me working in the system, I knew the agencies that I trusted. And we were able to, get in with an agency that we trusted. And we formed a really good relationship with the BCBA. And as we continue to do more research on ABA and hearing kind of what other, adults with autism were saying about how it was traumatic for them when they were a kid, we sat down with our ABA team and had a really kind of open heart-to-heart discussion that we were never. Our goal was not to extinguish any of our son's autistic traits. If he doesn't want to make eye contact, I don't really care. If he wants to stim, totally fine. Those are the things that we don't care about. We weren't out here trying to change who he was as a person. However, it was really important to us, as parents of a young boy, who is a person of color, who had very kind of violent, for lack of a better term, meltdowns, that we need to figure out other steps. Because as, unfortunately, if we look in the news, we do see, the horrific instances of people on the spectrum, especially those people of color on the spectrum, when it comes to interacting with law enforcement or other people within the community who don't understand, it can potentially be a life or death situation. So that was really kind of the reason why we chose ABA, because we were kind of at this crucial crossroads. And I know it sounds kind of silly to say, but at age 3, my son's meltdowns were already so incredibly violent that we kind of had no choice other than one of us would sit in his bedroom with him, and we'd sit with our back against the door and just wait it out to protect our other son and our animals and the rest of the stuff in the house. So, it just kind of boiled down to that was our only option. And so we learned the skills that we needed to be able to support him through those moments. And then he also learned the skills he needed to be able to not get what he wants or hear no, and be able to work through that in a non-aggressive manner. So I really, do attribute ABA with being life-saving for our family. And I think there are many other families who are in the same boat. And we tend to just hear the negative side of ABA right now. And I think the flip side, as an employee for the division, I work pretty closely with some of our very high profile or members who have kind of extreme behavioral challenges. And it's the same thing for them. There is not another option, and ABA is keeping them safe every single day. And I think that side of the conversation needs to be opened up more. So sorry to get on my soapbox, but
No, thank you. And thank you for sharing about that. Ashley, would you like to share on this?
Yeah, to echo what others have said, I've also really enjoyed working with the community or the autism community. Prior to coming to NAU, I was at Southwest Autism Research and Resource Center in their research department. I worked there for a little over 2 years. And through that position and my current positions, we're doing a lot of events where we just go out into the community and just talk to people about autism and answer their questions. And I've just really enjoyed like having those personal connections with people. And this is how I met Katie actually 2 months ago. She came to visit one of our monthly gatherings that my current position has each month, where we share resources with families who live in and around the Navajo Nation regarding autism services. So I'm just really thankful for all the connections that I've been able to make within this community, and also just I also really appreciate how the autism community is very much like come as you are, because I know like in society, a lot of times we feel like we need to fit into a certain box, but that just doesn't work for everybody. So I also just really appreciate how there's, like what Christina was saying, like, it's fine if you stim, it's fine if you don't make eye contact with me, right? Like all of those things are fine. It's just finding ways that, you can help your child or your whoever it may be, like reach success and have great experiences. So just really thankful for all the connections that I've been able to make through my professional connections.
Great, great. All right. Nia.
Yes, thank you. I mean, all of the above. I was going to talk about the connections similar to Ashley that we've been able to make along the way, and be able to have opportunities like we have today of having this discussion. Separately, I've probably met with several of you. I've had opportunities to spend some time with Lindsay, with Erin, with Christina, obviously Katie, she's on my team. So, having this opportunity to continue to talk about what we can do to better support the autism community is really important, because sometimes it just it feels like there's a lot of conversation about mental health and not specifically around autism. So being given this opportunity to talk about it and raise a little bit more awareness and acceptance of it is really important to me as a parent, as a family support partner, all of the above. I really appreciate everyone's insight on their positives as well.
All right, thank you. And that leads us to you, Lindsay. Looking at positives, and you'll need to unmute.
My computer's a bit laggy, so forgive me, I may need to jump off camera in a moment, but I would just agree to what everyone shared, but also taking it from a larger scale, sort of around state initiatives and state-driven outcomes. There's been a lot of work that's been done from the access level, so Arizona healthcare cost containment down. And, in 2015, Access really identified there was an opportunity for us to continue to integrate services and to develop a better system for families that were either living here or moving here that would really benefit from some additional services for their family. And so Access at that high level recognized from a state perspective, we need to do better in this area, and we need to drive integration, we need to drive outcomes for our families, so we know what we're doing is making a difference. And so over the last 10 years, being part of the Access system and seeing how the division has led a lot of integration around their health plans, we also, as health plans, are also, closely looking at outcomes and starting to identify centers of excellence. And Nia mentioned, a lot around the autism community. All of the Access health plans have providers that are identified as centers of excellence. We have autism centers of excellence, or those that specialize in birth to 5 or transition to adulthood. And each of these key providers are responsible to support the entire population of members that are receiving services from them. So how are we uniquely treating children, around screening and diagnosis as early as we can? But then at the other end of that, how are we making sure that young adults are transitioning into the adult system successfully, and we're able to connect them to resources that we are trying to create and hopeful to create all across the state of Arizona. So I've seen so much progress in that space, and I say that out of both sides of my mouth. A lot of progress, but a lot of opportunity still. When I talk to families or providers that are transitioning here from out of state or moved here because of our service array, there's so much thankfulness as they talk about our Arizona community and how we are connected, how we are collaborating, how there's member choice and family choice. And there's timelines around when services should be in place. We should not be waiting a very long time for a critical service, especially as we're talking about supporting our early childhood population. And I continue to hear from those in the community. There's been a lot of progress made in this area, and I would absolutely attribute the work that the state has done to drive this to really spearhead and energize a lot of providers and families of saying, all right, we got this, we know what we need to do, and we have providers that can support us on our journey.
Thank you. Now I'd like to open it up to those who are attending and not on the panel. In your experience, what are you seeing that are positive highlights, either as a family member or a provider? And I do see that Ralph put in the chat that there's an autism school in Sholo, and just wanting to be sure people are aware of that. I don't know about that school. But at any rate, anybody that's attending here would like to say something you've seen that is a positive change or a positive highlight regarding services or outcomes for this population. Kathy, you're on mute. Okay, Kathy's still on mute. Now we're getting a view of the cab, the camper. While Kathy's getting herself unmuted, I will add that seeing a Relias training provided for providers at the case manager level, just giving them a little guidance on working with communicating with people that are on the spectrum was a big thing, because when providers are being told you will provide services to this population, they need the training and the skills to do it. And they're still lacking on that unless you go into the private therapy range. So this is where I've seen positive change and still opportunity. Anyone else? All right, Kathy.
I just
Still-
wanted to share, I appreciate more awareness, more discussions, you know. It's an opportunity to keep learning, to make sure the terminology, the communication, you know. I remember hearing Nia make a comment in another setting, and it really stuck with me. You know, in peer support and family support, we hear a lot about recovery, right? That word. And it really changed my viewpoint when I was listening to, you know, let's emphasize more on the resiliency that's happening, because recovery can look very different in different spaces. And Nia, you said it way better than the way I just tried to say it right now. But I remember that sticking with me in, you know, how to be more inclusive, how to ensure that, you know, we're really talking about what does healing look like and what is just that space, you know, and maybe there's not maybe it can be defined even a little differently. So to be more open. So I want to thank you for that.
Thanks, Erin. I definitely want to say that came out of a deep discussion that we were having internally. So Katie was definitely a part of that conversation. We talked a lot about, it's a little hard, and I'll let Katie kind of speak for herself on this too, but it's a little hard to hear, you know, when they talk about recovery as it relates to autism, because it's not like someone's just going to recover from autism. And that's why, like, moving towards like resiliency side of it, it just sounds so much more positive versus the recovery side of it. I'll let Katie kind of mention her wording on that, because that spoke to me, which is why I mentioned it in the following meeting that we had with you.
Yeah, I think often a lot in behavioral health, we hear about recovery, which is applicable obviously to those who have substance use challenges. But I think for me, every time I heard that, I thought about my son as he gets older, and I'm like, you don't need to recover. You're I mean, you're amazing. What are you recovering from? Like, autism is fantastic and you're amazing. And I never wanted him to feel like he had to recover from what he has, because he'll always be autistic and he should be celebrated for being autistic, you know? So I think that, I know it's can be annoying sometimes of like, oh, let's change the language, but also like we should be cognizant of how what we're saying makes people feel. And already as somebody who has a disability, like I don't want to add to that, you know? So that's where I was coming from with recovery versus resilience, you know?
So this is Kathy Basher. Can you hear me now?
Yes.
Okay, so I heard, I believe the lady from Pollara, the Center for Excellence, share that respite care was available. Is it available in Yavapai County? And how many people, let's say a month, are utilizing this service?
This is Heidi from Pollara. We share the 600 respite hours with that the insurance company and DDD provides each individual. So we share those. We do provide respite as a clinic and organization. We do like group respite events 4 times a year for kids on their breaks, spring, winter, fall, and summer break. And then for the adults we serve is we kind of do it as, you know, as needed. If parents really need to, you know, a break to kind of negate caretaker burnout, or if they have, you know, something to do like a doctor's appointment or something that they really have to attend to, we will provide that respite and relief for them as well. I would say it's different per individual. Once a week, I provide 3 hours of respite to an adult because his parents are elderly and it gives them a time to do everything they need to do. But for kiddos, we tend to do it group respites 4 times a year or as needed.
Okay, do you feel that this meets our needs? Specifically in Yavapai County, I've heard from quite a number of people that respite, it really is not available. And is it similar? Does it look similar like in Maricopa? Is it more readily available?
No, it does not meet the need that these families need. We don't have enough providers to fulfill the needs in Yavapai County, especially as such a fast growing community. We do have a few respite homes, licensed respite homes that can do respite for over 12 hours, where they could spend the night just for children and get longer respite, but absolutely it does not meet the need. We're a team of 3, so if you kind of think about that, we can only do so much. And there is a huge need through the outside agencies that are contracted through DDD to really up the respite game. So no, I don't think it meets the need. I think there's a huge need, especially with
Thank
an
you.
aging population, right? In Prescott specifically, the population's aging, which means the caretakers are aging, which means they really need a lot of help.
And is the population increasing that needs to be served?
Oh, the growth is insane. Yeah.
Yeah.
But it's more readily available in other parts of the state. And if so, what can we do to advocate to get more resources in Northern Arizona?
I will speak just for what I've seen at Pollara Health over the past decade is it's literally a job, an employee shortage. Having enough staff within these agencies to provide that service is my transparent answer. You know, for example, I've been trying to hire a couple staff for about 6 months, and you know, the resumes are very limited that even come in. So I do not believe we meet what more urban areas are able to provide just from the lack of staffing. That, you know, Tucson and Phoenix, Maricopa and South tend to have more opportunities and more options of providers.
So is FIC I don't know if FIC is present, but are they able to provide respite?
I don't believe so, but I wouldn't bet my paycheck on that, but I don't believe they do respite.
Is Trish on the call?
No, Kathy, we don't have anyone from Family Involvement Center on the call.
Okay, thanks.
I do want to mention that if the families have DDD services, there are some, again, very limited in Northern Arizona, but there are some agencies that do provide respite care in Arizona. We're actually one of them. So we do have families that are receiving respite care through AZA United. Katie, as our family support specialist, actually carries a dual role. She's also a field trainer, which means that she does all the ATC monitoring visits for all the families in Northern Arizona. So she'll travel from Prescott Valley to Lake, not Lake Pleasant, that's in my backyard, Lake Havasu. So she'll travel all the way to Lake Havasu or wherever she needs to go to ensure those ATC monitoring visits are done. And we're actively trying to notify Northern Arizona that we want to be able to grow this part of the services that we provide. And to do that, we need to have providers. We're advertising for that. We're trying to add on more providers. We're actually trying to find some parents that might already have providers who can start with them, but also expand and provide services for other families as well. That's actually how we grew our Tucson respite services. Is we started with families who brought in their own providers, and then those providers said we can help more families, so they started branching out and being able to support more families, and we're trying to replicate that for Northern Arizona. It's a little bit slower, and I'm sure a lot of it has a bit to do with the parent provider program, because a lot of parents are looking to be parent providers, and they're not necessarily looking for additional support right now. So it's kind of a blessing and a curse all in one.
So can I ask, this is Lori, how many families are there in Northern Arizona, Katie, that are, and Heidi, anybody, Ashley, how many families are we talking about?
As far as that are,
Needing respite or having these services?
I mean, I have, with my families, I probably have like 40 or 50 families total, and all of them want respite. And I actually do have a provider right now that's looking for additional families to support. So I think part of it too is just like Nia said, just like getting the information out there, like, hey, we have a respite provider that would love to support other families too.
So this kind of brings us to the next question. We've rolled into it. What are the challenges you see as a family member or a provider regarding the system, services, gaps? And Ashley, you do some work with the northern tribes, the Indian reservations. Any comments on what's going on there?
Yeah, so I've had the privilege of being a graduate assistant for the Ascend project, which is autism support within and around the Navajo Nation. So I have not been on the project from the beginning. This has been a work in progress over the past 5 years plus. But essentially, the problem that a lot of our families who live on the res or in more rural areas have is just access to services and also awareness of autism in general. So the project that I'm a part of, we have parents who are Jeanette and have a child with autism who are considered family advisors, and they lead other parents of children with autism who consider themselves Jeanette. They lead them through lessons from Parents Taking Action, which is an evidence-based parent training and education program that has been culturally adapted specifically around Navajo culture. So that has been the way that we've been able to reach more people is by doing a lot of like telehealth. So a lot of these lessons that family advisors are having with their parent participants are via Zoom. We're providing hotspots to families who do not have reliable internet connections free of charge. So all of those things have helped just like reach more people, but still the hardest part of the project has just been getting the word out there so that people know about it. You know, we did a lot of events, a lot of advertising, and still it was just hard to reach as many people as we wanted to. But as soon as people do come across us, they're like, wow, I wish that I had this service like 10 years ago or whatever it may be. So there's a lot of opportunities for growth, but you know, we're slowly making some progress there. And right now, our team is hoping to expand this type of programming to other tribal communities around the Southwest. But again, it takes a long time. Like it took several years just to adapt the curriculum to meet Dana culture. So it's an area that we're still working on, but all of those things have helped us reach more families. I don't know if that answered your question.
So, who else would like to chime in on challenges, gaps? After that, we'll look, and that ties into solutions, the next thing. But I know there are a lot of challenges. There are gaps, and I'll let you panelists jump in on that.
I think for me, and I'm probably just regurgitating the same thing over and over, but in rural communities, there's just not access to services. We don't have, I can just, from a personal experience, my son doesn't have speech, he doesn't have OT. And there's communities even more rural than where I'm at, where there's nothing even close to that. That's where the parent provider program is nice, because at least there is some sort of support that the kiddos are getting, which has nothing to do with this. But I just think in rural Arizona, there's just not the support in kind of any capacity. The services just aren't there.
I'll add to that. In fact, this morning we were just having this conversation in our morning huddle with my team. I was asking Katie, hey, did you ever get a hold of that one psychologist up in your area? She goes, yeah, cash pay. Like, okay. So even though there might be providers out there, they're on the cash pay bus. Like they don't want to contract with insurance. They don't want to work with access. And unfortunately, it's almost like they know people need it and they're going to go to them anyway, because when you're cash pay, you have way more availability than someone who accepts access and all the health plans, right? So that's been a real struggle, is finding providers who we can refer families to, especially in Northern Arizona, that are contracted and are willing to take access members.
I'd love to jump in there. And I think that's a bit of the challenge we experience. Mercy Care, as an access health plan, we are trying to incentivize providers to serve rural counties, to serve certain regions we know are underserved to that point, and trying to bring providers in that are comfortable serving the population. I think that has been the biggest challenge, because it's twofold. We have a lot of providers in many areas, but we don't in others. We recognize there's providers in those territory, but there's a lot of limitations in working with them. And so, and to kind of step ahead a little bit too, Lori, one of the solutions we found is exactly what Ashley talked about in the NAU program, is we've utilized community reinvestment grants to actually support the Ascend program, because we found we can't do this alone. We can't incentivize providers in those regions to work with us for good and bad reasons. I definitely don't want to attest to it all being, insurance is scary, insurance is awful. That is all real too. But there's also many other areas in which providers are interested in doing that level of work. but we find that the community providers in the community know who we need to be serving and know what that delivery system needs to look like and understands the culture that Arizona brings. And so, we've been proud to work with Ascend, and we are committed to that process of, if they're not contracted, but they're a community provider, let's figure it out, because we can't, at the end of the day, have our families waiting and in desperate need of something that we can't provide because we don't have a participating provider. Like, that's just not a good reason anymore. Another piece to that too, though, and some challenges we've seen, and Lori, you talked about this too, that we're starting to see some training through Relias. Not all providers have access to Relias, so that's one element of concern. So something we're trying to do from a workforce alliance is, how can we make sure physical health providers or community providers that aren't contracted, or providers that don't meet the provider type for Relias, right? Maybe some ABA providers don't meet that. They're not accessing any of these trainings, which the division has poured all of its efforts into building within Relias. So we're still finding access to specialty trainings is a challenge, but just understanding the unique needs of the population, not breaking up any more intellectual developmental disability from a potential family concern, a level of stress within the family, or a behavioral health diagnosis that's being untreated. We need to be talking about these things together. Our service planning needs to be done together. We shouldn't be pulling back on the planning side to say, well, I think someone else is responsible for that. No, we're all responsible for that. And we need to do our due diligence of finding the right service at the right time, regardless who's funded to do that.
Excellent. Thank you for bringing that up. And, and this is great, the awareness, where not everybody has access to Reliance. It's great that it exists, but, and I like your mention of community investment grants, real important. Heidi, you look like you were having some thoughts to share.
Oh, I just concur with what the panel is saying. It's one of our biggest barriers is access to providers and community education. It's starting to get out there. I trained the Prescott Library staff on autism when some of their kiddos come to their programming there. And we just talked about like sensory friendly environments, letting them STEM and just be, just be them, and still can be productive and learn and engage in their programming. But we have found just, lack of providers and local supports. And then you look at those social determinants of health then impact those families because they can't afford to travel. They can't afford to go to Phoenix for a psychological eval, a full autism testing. And so, I was just mirroring what the panel has said.
Okay, if I jump in really quick, Lori.
Go ahead.
Okay, I'm going to take things kind of in an opposite direction, and Lori, you'll appreciate this because you and I kind of live this often, or day to day, I would say. I think there's a very, very large gap between, or not between, but for those members who do not qualify for long-term care. We see people who are not getting any of the services that they need because, their autism is not bad enough to qualify for the services that are tailored for them. Lori and I have been supporting this young man for, oh gosh, I don't know how long it's been now. But every avenue that we explore is just failing him left and right. And no matter how many times we apply for all techs, we don't get it. And we've appealed and mom has done everything within her power. However, there's this really kind of fine, I don't even know how to put words to it because it's just so upsetting to me, I think. And I mean, Lori and I were on a meeting just last week where the therapist was saying, he doesn't engage in group. Well, yeah, he doesn't engage in group because he's on the spectrum and he doesn't want to sit and talk to people. And it's like listed all over his chart. But did anybody take the time to look at that and read that? Something as simple as getting to know him. And figuring out 1 or 2 strategies that could draw him in and have him be willing to have the conversations. And especially, I think when we're looking at placement, there are no great BHRFs or especially substance use treatment facilities that will really tailor to somebody who is on the spectrum. And we are just watching this poor young man fall further and further into the crack, and there's nothing we can do. So it's just, it's kind of a constant thing that Lori and I are up against. And if anybody has any suggestions, we would be more than willing to listen to them. But this is across the state. He was up in Northern Arizona, then he's down in Tucson. He's gone to Phoenix for treatment, and none of it fits his needs because he's on the spectrum. He also has an SMI designation. He has an immense amount of trauma, and it's just, one thing after another that's stacked against him.
Yeah,
I was
I
gonna
was
bring that up
actually
if you didn't, and I will share just a little bit. His mother is his legal guardian, and she has been an advocate for him, continues to be. I got involved when he aged out of the youth into the adult service a couple of years ago. He's 22 years old now, and the majority of these past 2 years, he has been in jail. He has been inpatient psych. He spent 8 months in a berth, but the insurance company wanted to get him out of there after 3 months, said he was good to go. And through appeals, he was able to stay in there for 8 months. And this is where the system isn't set up to accommodate his needs. The staff providing services don't have the training to communicate with him, and meet him where he is. And his restricted interest with certain substances and his high IQ, his ability to use the computer to research drugs and medications, make it very challenging. So, I'll go back to what Christina said. What do you suggest? Where do we go?
I don't know if I have suggestions, but I was also going to bring this up, just like co-occurring conditions that come with autism or can come with autism. It's so common. Like if somebody has a diagnosis of autism or ADHD, they're far more likely to have some other type of mental health condition, whether it be depression, anxiety, PTSD. And that was something that really made me want to go into psychology as at the doctorate level, is because there's so much misunderstanding around how like autism interacts with these different mental conditions. And like when you think about the evidence-based treatments for PTSD, none of those have been studied with people who have autism. And I've just heard from people who are autistic adults that have tried these different types of services and it just has not helped them. So I think there needs to be a lot more research around it. And as somebody who's an emerging researcher, it's something that I definitely have an interest in. And I also think that there needs to be more awareness to providers in general to not just be so specifically focused on like one diagnosis or one type of treatment, but rather like understanding all the different ways that somebody can go about healing, and not like healing from autism, but healing from like trauma or depression, anxiety, whatever it may be. I think that there just needs to be a lot more education around like working with neurodiverse individuals as a whole. And that's, again, why I'm trying to get into this field and something that I'm passionate about, because it's a need that comes up and anybody who works in this field can attest to that.
I'd like to add to that as well. Maybe the Katie is the better person to add to that. Mine is more of like a solution to the situation, but it makes it that much more complicated when we are working with an adult who doesn't even have a guardian. So they are their own guardian and they're trying to navigate these waters, and it's so complicated because they need so much support from so many different entities. I'm talking social services, I'm talking food on the table, just anything. And it's really hard to get all of the different things all talking to each other to get this to happen. So I'll let Katie kind of share the experience that she's had. And she's brought this up at so many meetings because she's constantly trying to collect information to share. So I'll let her kind of take over because, like I said, mine is more of the solution side of I wish we could make this happen. So we can come back to that.
Yeah, I have this poor client of mine who's just gone through so much, and he had his diagnoses, and then we got him SMI because of course he wasn't going to qualify for DD because he was already an adult in all techs, and he's just really been struggling, and he has all of these different diagnoses, and he's having to re-talk about his diagnoses with different people within the behavioral health home, and I'm trying to get him help with, EBT, and then also he's going to all these appointments within his behavioral health agency. He finally gets connected to them, and then lost his job because he's having to go through all of these appointments, and now we're trying to get him on unemployment, and everything is just such a challenge. I mean, this poor, and I know this is not unique, this poor guy who's going through all of these things of just receiving this diagnosis, of finally as an adult figuring out what he is, right? And then having to navigate all of these systems who honestly just are working against him. He's doing everything that they're asking. I'm on the phone. No, I'm not kidding. At least twice a week, we are on the phone for hours calling. I'm going to cry. I'm such a crier, sorry. But we're on the phone for hours. We're calling Access and we're calling unemployment, and we're trying to get this guy who's doing everything that he's supposed to, just trying to get him help, and he can't get help. Like that's, and then also having to relive all of this trauma of constantly telling, like, this is my diagnoses, talking to a new person. Oh, what are your diagnoses? Let's bring it up, like, and re-traumatizing him. I don't know what the solution is, but it sucks. Sorry for being a Debbie Downer.
No, this is, we need to know what's going on, in order to know what needs to be done, and then, work together. Libby, I wonder if you'd like to share a little bit about your experience as a mother.
Sure, thanks. A little bit throaty today with allergies. Yeah, I have. I myself have been diagnosed with autism and ADHD, so I am autistic. And two of my adult kids, one 25 and my eldest 28, are both on the spectrum as well. One with ADHD and autism, the other with autism and other co-occurring diagnoses, because as has been discussed, all of us have lots of co-occurring diagnoses with those. One of my kids, my 25-year-old, he was diagnosed as a child. However, because he has never needed that LTC level of care, he has not received services under DD or LTC. And as he's gotten older, he is qualified as disabled under Social Security, however, which always was a bafflement to us as to how the federal government would cover his living expenses while the state of Arizona would not see him as needing these developmental services that would have clearly supported his needs. After he turned 18, we found a lot of services kind of went away. Once he graduated from high school and he was getting wonderful services through the school district, those services became unavailable to him. He's currently trying to work with vocational rehab, um, to start going into the working world, considering he's also terrified right now that his Social Security and Medicaid benefits might be going away under the new administration with the changes that are being put in. It is frustrating. I've been working in this system of care as a parent for 28 years, and as a professional or paraprofessional for almost 7, and I still find myself banging my head against brick walls constantly and trying to find services for him and his brother who has physical health challenges along with the autism diagnosis. He has been considered his elder brother, my eldest son, has been told that his physical challenges are not quite enough to qualify him for the services he needs, nor are his mental health or developmental differences enough to qualify him for the services he needs. And so, therefore, two of my offspring are consistently falling through cracks where I can see them being successful if they had the supports that they needed in place. These are they are level 1 and level 2 if you want to look at diagnostic codes. And while they may be able to express themselves really, really well, they need supports that they cannot obtain. Um, I mean, perhaps if I made 3 or 4 times as much money as I do in my job, I could get them these services because there are cash only services available for autistic folks on the spectrum. Um, However, those are not covered by any public health service that I have been able to find for them. And they're both really, really good at advocating for themselves, which I think honestly has hurt them. So, and I'm sorry to have that full of negativity, but that's kind of where I'm at with this process. And every year I go through it again, and every year we run into these challenges, and every year my children grow another year older and don't have the supports they need to be successful adults. I'm a little bitter.
Well, and rightfully so. It's a rough, it's a rough road, and I think when you mention that they're being able to advocate for themselves works against them, I had to just kind of swallow my heart there, because you're punished for being having skills. It
Yeah.
doesn't diminish that you need what your needs are. I mean, wow.
I just kind of wish that the systems of care would really understand the wheel of autism, not so much the linear, look of what autism is. I really wish there was a better understanding of the pie. So when I talk about autism, when I do any presentations or any trainings on what autism is, I show a diagram of a pie chart. And right, somebody might not be severe enough in certain areas. Maybe they're great at communication. Maybe they have a really high IQ and they're graduating with a master's degree. I actually know someone who's in that situation. But they could really be struggling a lot with social communication, social anxiety. They could be struggling with their daily living skills. They might do great academically, but they're really struggling with their daily living skills. And that definitely, I completely understand what Libby is saying, because unfortunately, those are the individuals that seem to constantly be falling through the cracks and not get enough support from the services that are out there. And I know from a higher up perspective, I mean, we're looking at the Lindsay Zeters of Mercy Care, the Christina Hedges of DDD. They're over here trying to make a difference. But for whatever reason, as it trickles down, sometimes it just kind of like, what's going on? And I've reached out to Christina often, like, what should we do to help this person? And it's awful. And I really wish there was more we could do to help some of the folks that are, again, for lack of better terms, falling through the cracks.
Kathy,
Yes.
you unmuted. Did you want to say something?
Well, I'm not sure that I do or not, but as listening, I'm just going back. For those of you guys don't know, I was institutionalized for 7 years, and given ECT and insulin shock, and then I ended up as a bureau chief at Access and also on the faculty at ASU. But I look at the struggle. I have a scattered IQ, gifted, but I just, I look at this, how difficult life has been. And I'm very, very fortunate that I survived this. But the other day, Lori came over, and I don't know why I'm just kind of sharing this. She came over to talk, and she didn't know it, but it took every effort for me to be able to sit there and talk because, the eye contact, the social anxiety, and now I live alone. I live up in the mountains alone. I spend days without talking to people, and that's my solution. I have been diagnosed to be on the spectrum. I've had many other diagnoses too, PTSD and ADHD, and yet and I'm fortunate. I feel like I'm very, very fortunate, but it didn't have to be this hard, and I feel that I'm extremely lucky. Um, so this is just an area I'm very concerned about. And then one little thing I'd like to add is I also sit on the governing board at the state hospital where I spent a year and a half. And there was just an article that came out about people with autism in the forensic unit, and how difficult it was for them with the noise. And, they're just inundated with noise and stimulus. And this is another thing that when our people go into births, they go into hospitals or whatever, people don't recognize that we're not able to separate all this stuff. And a lot of the acting out, my acting out, their acting out, is due to the environment that we put them in. So I just I'm just kind of bringing all this together. I have really no point other than, thanking you guys for sharing this, and, how can we make it better for people that follow us?
And Kathy, did you share with me earlier that there are 3 people in ASH that are on the spectrum currently?
That's in the civil unit. Christina and I talked about that, but we also have the forensic unit. We don't know how many people are there, and ASH is not funded. They're funded to treat specific populations, not people with personality disorders and autism. So as a result, they don't have specialists in that field. So this is something that we can do as advocate with the legislature. There's bills going through. I'm working very closely with Senator Miranda on some of this. And so on that level, we can make people aware. And all of this is we need to make the legislature aware of these issues.
Thank you. And Libby is shared in chat that KZZZ, the NPR channel in Maricopa, just did a series on autism in the state hospital. Libby, is there a specific takeaway from what they showed that you'd like to share?
The takeaway is that there needs to be more training at the hospital level of staff on autism and how to work with folks like us who have these challenges. There's very little understanding of the needs, and even the takeaway that I got from it is that even when needs are being voiced, that there's not really an understanding of why those needs for services or accommodations are necessary, and therefore they're not being put in place.
Well, that exactly, but my comment is, people have a tendency to blame the hospital and say what a horrible, awful place it is. If we continue doing that, we're not going to get anywhere. The hospital has its hands tied because they don't have specialists in these areas. That's where we can advocate at the legislative level to change the criteria for the people that get admitted into ASH. And to provide, to keep them out of there to start out with.
Well, yeah, that would be the first step, wouldn't it?
That's actually something that, if I'm not mistaken, our organization has worked with a couple people that have come out of ASH. So our goal was to train the staff within and outside of the hospital and help to establish a placement for this individual, and then following that, train the staff of that place to ensure that this person does not constantly go back to the hospital. And a lot of it is hospital seeking behaviors. So it's really important to train the staff to understand hospital seeking behaviors and work with the member individually to eliminate that. And so far, so good. I mean, I don't want to jinx it, but we're still not back to the hospital. So.
And a hospital setting can be very comfortable, especially with people with autism, because it's very regimented, and they can fit in for the rest of their life. They could be happy with it.
And some of these folks that we've worked with, they know exactly what to say and what to do to get right back into that hospital. So
Absolutely.
that's the hospital seeking behaviors that we're working with.
What about the facility in the White Mountains that Ralph referred to? What do they do there? And what are there other places like that?
Lori,
Yeah.
it's actually a school. It's gone under different names. I don't have the name right in my top of my mind, but I drove by it the other day, and it's a school for people on the autism spectrum. I don't know much more about it than that, but I was impressed that in a small community like Sholo, we would have that kind of a school. We do have an autism foundation group here on the mountain also. Again, early on in the beginnings of our NAMI chapter, as I was poking around the community, I came across these people, and they sponsored a presentation one time on the autism spectrum from somebody down, I think it was Mesa Police Department, that came up, and it was my first understanding of the complexity, if you will, of the autism spectrum. They used a triangle to describe the workings of autism in the mind, if you will, as opposed to what Lindsay was talking about, I think using a pie chart. I found that to be interesting because of the complexity that, stimming is in one area, but, it can bleed over into other parts of the autism spectrum. That's about all I have to contribute. Sorry.
Well, that's more information than we had before. Thank you. So what else, other panel members, would you like to say about gaps, solutions, challenges? What can we do?
I think we said a lot about Arizona State Hospital, but as a behavioral health provider, those same challenges pretty much go to any level 1 placement, any hospital. There's one hospital, I think the special needs unit over at Aurora, that, is pretty good, but for kiddos on the spectrum or with developmental disabilities, we tend to send them out of state. The providers inpatient at those higher levels of care tend to either reinforce, a challenging behavior, reinforce that inpatient stay. So it's just not Arizona State Hospital. I think it's a challenge just across the board.
I can echo that challenge. I think we see that a lot, and I'm sure Lindsay can talk about it as well. We often have members who will, sit in emergency rooms for hours and days because there is no, appropriate kind of level 1 for them. They can't participate in the milieu, they can't participate in programming. And so then we're kind of at a loss. But I know Mercy Care, maybe Lindsay can talk about some of the solutions that they are working. I know they've got a lot. Sorry to put you on the spot.
Thanks, Christina. No, that's totally fine. And I will tell you, kind of hearing some of these challenges, it's still super candid. It's very frustrating, and it's very real, and it's the real experience for a lot of people. And I think Mercy Care, and I can definitely speak even on behalf of other plans, we are trying to figure it out. And that looks like incentivizing conversations with local providers. How can we do this? What do you need from us? We gave a community reinvestment grant with United Healthcare to one of our providers here to build a level of care, particularly for this population. We've approached all of our out-of-state providers. Like, there's been a lot of conversation of, what are the perceived barriers and how can we get through some of that? How do we develop training for you, or how do we help with recruitment, or how do we help with workforce retention? Because that stuff is all very real. But at the end of the day, we still have a need for a service, and we have to contribute, continue to work hard on some of that. We've done a lot of partnership with Aurora SMU. We helped to develop their unit years ago. And we, actually, to Nia's point, we've created a partnership between AZA United and Aurora SMU to help with that discharge planning. And a lot of that ties in, if you guys are familiar with the Building Bridges model, which is helping young people and adolescents, adults, transition out of a higher level of care and still receive the services from that level of treatment back home to help with integration back into the community. So there's been a lot of work that we've done around just transition and access to services, but it also starts on the outpatient side. How do we increase tolerance with our providers that are supporting kids and adults that have high intensity behavior? How do we increase the tolerance of staff? How do we really assess the behavior, whether it's truly dangerous or if it's attention seeking? And how do we utilize community services before we ever look to utilize inpatient or a level of treatment? Because a lot of those interventions are not appropriate for individuals with IDD, and it can cause trauma and a different area of concern that we could have prevented if we had better equipped staff in the community.
So I have a question for you guys. I can remember going to meetings, high-level meetings with psychiatrists from DD and from Access, so for the adult system. Okay, and so those individuals, the two sides were very angry at each other. They did not want to work together, and there was a pushback to bring a person from the DD system over to the SMI system. So now when you have a person that's been diagnosed with autism and becomes an adult and also has a mental illness, how does that confuse the system, or how are they treated within the system?
Miss Kathy, I'll speak to that. I tend to do those SMI determinations for the autism population here at the clinic, and Solari is the contracted provider that makes that decision. And when they see that autism diagnosis, I normally get a call from the psychiatrist, and they want me to separate that individual's abilities. Either is that due to the autism diagnosis or the other behavioral health diagnosis, and they literally want me to split that. And frankly, it's almost impossible. So it's still a challenge, and it still is contentious at times.
So then what happens to the individual? Because if they give them regular SMI services, they're traumatized. It just set up to fail. I guess that's what we're talking about.
This is the part where I say these are the folks that fall through the cracks, because I have one particular member who was turned away by us for SMI. So we went the DDD route. They're turned away by DDD because they say we're supposed to go the SMI route, and SMI won't even talk to them because now they have to wait a period before they can try to reapply. It is almost set up to fail because for these individuals, and I've had conversations with this person. She is her own guardian, but she has healthcare power of attorneys within her parents, and she's in Northern Arizona. She's actually at Rainbow Acres, and they love it there. It's a great program there, but she needs some support. She needs additional support, and she can't get it because DDD keeps telling her that she needs to go to SMI, and SMI says, nope, this isn't SMI, go to DDD because you have autism. And so it's really hard, Kathy.
Right. Nia, let me ask you a question, because this is something I discuss with DDD and families. If they get that SMI determination, a lot of the folks do we feel that, you know, if they went into a BHRF, if you know, being such vulnerable adults, is that the right place for them to share a room with somebody else, you know? And so if they get that SMI determination, I then am kind of hesitant to look at putting them in one of the behavioral health like group homes, you know? Does anybody else kind of have that experience when you're with DDD and you're like, well, they need to be in a behavioral health home, and you're like, but they're really vulnerable. Are they, you know, are they super safe in that setting? I mean, how would you guys address that? Or ladies, I guess.
Well, I was under the impression that most, if they're DD and with autism, the bursts that they go into are specifically for that population.
Not in Northern Arizona.
Not-
Okay.
yeah.
Okay.
Not-
Yes, you're right. Sorry.
And the gentleman that Christina and I have been working with for a couple of years was in a birth in Northern Arizona for 8 months. And it was the only time, it was the longest time in those years that he was not in a psych hospital or jail because he needed that level of structure. But yet Altex says, no, you don't qualify, and the birth, you know, is temporary. So this is a definite gap housing for folks that fall into this. And Heidi, I appreciate what you said. You're being asked to do the impossible. You can't divide a person. A person is a whole comprised of different parts and pieces.
Yeah, I tend to say we work within a systems of evil that really relies on like the good nature of humans. And you know, the more we just advocate and pursue, but it is a system that is challenging to navigate even as a professional that's been in it for, you know, over a decade. So I have an adult who's homeless in who's in a BHRF now, but you know, Altex denied him because they're like, well, he's successfully navigated homelessness. And it's like, not really, you know, he did not. He was constantly victimized. So he gets denied SMI because of the autism and denied long-term care because of his success, you know, on the streets. And so it's just, it's heartbreaking.
So, and then you mentioned Altex, where there's a bill in the legislature to remove the words mentally ill, because if a person has that diagnosis and they try to apply for Altex, they can't be admitted at this point. But the reality is there's not enough money to even provide Altex just for the people that have physical illnesses and challenges. And so that avenue is kind of shut as a reality for treatment for most of our people at this point.
If only there was something in between, right? So, that's the hard part. It's all or nothing. There's, and that's what makes it to where the states run out of money. I mean, what's going on with DDD in present times, it's really scary with the funding there. It's just wish there was something in between where people could have access to some supports wherever they need it, kind of like meet me where I am. Like, this is what I need support with. I don't need all these other things. I need help with this thing. You know, I need help with housing. I got this. Like the person I'm referring to in Northern Arizona, the one that's at Rainbow Acres, she can't live in a group home. She's much healthier living on her own, but that's working against her. You know, she does not do well around other people. She needs to be alone. And that's what she wants. And because of that, because she has self-help skills, they're not approving her for any support or services. And that's what's causing this to happen.
Yeah, it goes back to your point, Nia, about how it's not a spectrum, but you know, because they have a lot of strengths, you know, I always say to families, you could be a level 1 in certain setting and environment, but drop down to a level 3 with substantial support depending on that situation and setting. But that's not how the system's set up. You know, they think you're, you know, whatever your diagnosis says, that's what you are across all settings. As somebody who's living with autism, you know, I do pretty good. I'm pretty educated. but I get help paying my bills, you know? So if you look at that, it took me a long time to live independently. And so I never met criteria for services and supports, right? Because my IQ was super high. I did pretty good. I'm always super social, which always was a negative. It counted against me as well. But you're right. We need to change our language and change the way we look at autism as a diagnosis, but that's, personally what I have noticed is because I have a lot of skills, I didn't get a lot of supports.
I'd like to add something for my own son, just real quick. And I think this speaks to what you're saying, Heidi. When my son is 17, he'll be 18 in January, right? So like, I'm going to get ahead. Let me get this reevaluation just kind of done and on the book so that I don't have to worry about it when it comes time for DDT redetermination, should they ask for it, right? So I went and I got the appointment. We got the evaluation done. And the whole time I'm thinking, they're going to say level 1. What if they say level 1? I'm just over here worried about they're going to say level 1 because he's made so much progress. My son was nonverbal. Today he's bilingual, So it's phenomenal to see so much growth in my son. So when I sat down for that feedback with the diagnostician and she said level 3, I was floored. I was shocked. I remember I was telling my team, I was like, you guys won't believe this. They said no was a level 3. And then as I read the report, when I got the report, I realized why. And it made so much sense to me. It's like, yes, he looks like on the surface, even to me as his mom, it looks like he's made all this progress. But as I'm reading the report, everything's making sense to me. He doesn't have any friends that are his peers, that are same age peers. He talks like an 8-year-old, and his friends are 8 to 10. He has neighborhood friends. He prefers to go play with his neighborhood friends and ride a scooter versus going to baseball practice with same age peers. His communication is really, really not where it should be in terms of pragmatics, in terms of having a normal conversation like a neurotypical 17-year-old, right? So that kind of goes to what you're saying, Heidi. It's like, even me as his mom was seeing him differently than what the diagnostician was able to diagnose. So that huge difference between mine and her perspectives, there's so much in between. Now we're having a DDD eligibility specialist thrown in here to make that decision. Now we have a Solari over here trying to make that decision, someone they don't even know and they haven't any time with. That's what makes it so difficult.
Thank you for sharing all that. It gives a real in-depth view of the complications and challenges. Christina, you have your hand up and we're getting close to time.
Sorry, I was just kind of gonna echo what both Nia and Heidi had said. I think we're having this discussion and we're not even talking about the potential for people masking, which then throws in a much bigger kind of problem. Very similar to Nia's situation when my son getting him his diagnosis was incredibly hard. We went to one developmental pediatrician in Tucson. This was 7 years ago, something like that. There wasn't very many. So we waited the year for the appointment. We finally got it. Did she do any formal evaluations? Nope. She said he made enough eye contact and had enough joint attention that he would not qualify for anything. She said, oh, hold on now. She did diagnose him with sensory processing disorder, social emotional delay, and behavior problem. And I think a communication delay as well, which, if you add all of those together, screams autism. So then we went the route of, we were fortunate enough to get a private eval. So we went back to the lady a year later with our 25-page eval with our neuropsych, who observed my son in her office, at our house, at his daycare. She diagnosed him with level 2 autism and ADHD. We proceeded to give the the developmental pediatrician, the report. She read it, and her exact words were, "That was an interesting read, but you can't have autism in some situations and not in others." And yeah, so this is just kind of my whole, I don't know, again, my high horse that I stand on. And again, he was only 3 at the time, so it's not like he was masking intentionally. But now he's 8, and he is hyper aware of any situation that might be perceived as embarrassing. He was watching a movie. They were watching, I don't even know, the Charlie Brown movie yesterday, and there's a situation where a child is embarrassed in that movie. And he is so in tune with what everybody else around him is doing that he had to stop watching that movie, because when another child was embarrassed, it made him so uncomfortable. And so he is constantly masking. And there are so many times and so many situations when we end up explaining, like, you know, he is autistic, he's on the spectrum, and people are like, "I had no idea." And I'm like, you know, if you spend more than an hour with us, you'll figure it out. He doesn't just wear pajamas on the weekend because he's a cute kid. He wears pajamas on the weekend because wearing any other clothes will send him into a panic attack. There's days when he physically cannot leave the house because he'll have a panic attack. So I think, you know, we need to really start looking at all of those things, that autism does present itself differently in different situations and in different environments. And yes, while you might not be autistic, or you might not shut your autism off in one situation, you definitely can mask heavier in others. And we need to be able to recognize that as well.
That's so stressful. It's so stressful to mask. You know, it's just, you got to go to bed for the rest of the day.
Well, I want to.
Sorry, one more thing really quick. My son he's a genius. He does phenomenal in school. He does struggle some with peer interactions, but by the time he gets home from school, he is so burnt out that literally the only thing he can do is he sits in one chair for the rest of the evening and is on his tablet. He eats in that chair. He does everything in that chair. He cannot move until it's time for dinner. And asking him to do anything else it won't happen. So.
Thank you for that. And Libya, like you said in the chat, masking is a survival tool, especially for autistic folk in marginalized communities. Kathy, if you want to thank everyone, and then we'll go into announcements.
Well, yes, I want to profoundly thank everyone. This was beautiful. It was very sensitive. And I am going to ensure that Senator Miranda gets this tape. She will love it, because you guys have very nicely highlighted many, many different issues. And so we'll utilize this going forward. What else am I supposed to do? Just thank you.
Okay, thank you.